Start. Am I audible and visible? Let me confirm. Am I audible and visible? Am I audible and visible? Okay, fine. Let us continue. Hello everyone, welcome to Unacademy Future Doctors. I myself, Dr. Dipti Kariya. I am MD PhD Physiology and I am your faculty for Physiology. Okay. Let us start with some announcements as well as some important features regarding Unacademy. Starting with first that we are providing NEET PG notes. These are the comprehensive notes for next that is NEET PG 2023. Okay. So these notes are provided for the students, those who have subscription more than 12 months. Okay. Next announcement here is here if you take 1 year and above subscription, you get extension of 6 months. Okay, and you can get this with 10% discount if you use my code Dipti10. Okay. Now, certain features regarding our subscription, as you all know that we have two kinds of subscriptions, plus and iconic. In plus subscription, you can choose the best from two of the best, and they are you can choose the best from the best. Here you can access both live and recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can compete in live tests and quizzes, and you can also access question bank, which is having more than 25,000 questions. Second, that is iconic subscription. Here your access to the best from two of the best, and the two are, one is Unacademy and Prep Ladder. With Unacademy, all the features we have explained, and second, that is Unacademy and Prep Ladder. With Prep Ladder, here you can have clinical and integrated essentials, video lectures from the dream team, question bank 3 with active guidance, system tags, and much more, rapid revision and snapshots and treasures, and 2021 dream notes. Now, here these are our NEET PG 2021 toppers, and Focus FMG toppers are also there. We also have added certain features in our special class. We made the special class interactive and live. You have facility for the poll for the learner. Raise a hand facility is also available. You can never miss a class, as you are always notified for the class. You can get PDF notes for the lecture, and you can access the class at anywhere and at any time. Another certain other batches also has been started recently. This batch that has been started from March 2nd to May 2nd, that is for 2 months, and NEET PG 2022 PYQ batch, previous year question batch. Second is Focus FMG 2022 comprehensive batch for 2 months. So if you are planning for FMG, you can join this batch for 2 months. For 9 months batch also is available, that is from 2nd March to November 2nd 2022. Another is Target Next 2023. This is complete 1 year batch. Here you can get complete guidance of all the subjects. Okay, subject wise batch is available. Another all educator revision batch also has been started for 2 months. That is from 2nd March to 2nd May. Okay, so you can enroll if you are planning for NEET PG 2022 in the month of May, next one. Another Focus FMG. For FMG, we have two batches, one that is for 9 months and second that is for 4 months. So this batch was started, 9 months batch started from 16th Feb to October 22, and this is from 16th Feb to May 22. Another announcement, important announcement here is we are launching Unacademy Lite for NEET PG. Here this is NEET PG test series. This is very important for students to evaluate themselves. Okay, here overall 450 plus practice test they are present that we are going to take, and this test they include subject wise test series for all 19 subjects which you are appearing in your Focus FMG, in your NEET PG, that is one, Second, system wise test series batch for all the 19 subjects. Full length mock test papers are also available. PYQ, previous year question papers, are also solved in this batches. Test series that is curated by top educators, that is also available, as well as 90 plus grant test they are we are going to conduct in this NEET PG Lite for Unacademy. That is NEET PG, INICET, FMGE, grant test, PYQ series. This all will be taken. This is our subscription plus or iconic. You can subscribe from your mobile, any of the subscription you can join. And longer the subscription duration, cheaper are the rates, you can see here. And you can get extra 10% discount if you use my code Dipti10. Now, another important feature in our app is you can take a quick quiz. This is also option. You can see here, this watch this video and you can easily go to this option. Take a quick quiz, this one. Just select this and join a quiz, and you enter number for today's quiz, this one, 845709. This is the number for today's quiz, 845709. Okay, if you enter this code, you can directly join the quiz. Okay, now let us come to our today's topic. Today's topic is one of the important topic, that is cardiovascular changes during exercise. As a full question also, this is asked in first MBBS in the first MBBS, as well as MCQ also will be asked in from this question. Okay, different types of MCQs may be uh, selected from this question. So let us start with the question. So starting with exercise. What is exercise? Exercise, that is a period of increased energy expenditure. When anybody performs exercise, energy requirement, energy expenditure is increased mainly by your skeletal muscle. Okay, and this energy requirement by skeletal muscle, that is fulfilled. How the skeletal muscles are getting more energy? Because our body is doing adjustment, respiratory adjustment, cardiovascular adjustment, circulatory adjustment, metabolic adjustment, and adjustment in the temperature. By this all, our skeletal muscles are getting more oxygen. Okay, and more energy is produced. Okay, now what is the importance of physical exercise? Physical exercise, one of the very important use of physical exercise is it is used to assess the work capacity in healthy individual, how much work a healthy individual can perform. Okay, second, it is also important for improvement in the performance, improvement in the fitness and physical conditioning of athletes, sports person, and military person. Regular exercise increases the performance, so that is second importance. Okay, third, it is also important for physical fitness of general population also, because extra energy which we are consuming, that is definitely burned by exercise. Okay, another is it is also important to prevent cardiovascular diseases. It is one of the very important factor that prevents cardiovascular disease. In so many journals, it is proven that regular physical activity of at least 45 minutes prevents the risk of cardiovascular disease in general public also, if the person is performing 45 minutes regular exercise daily. Okay, another use of exercise, that is it is used as a stress test to find out whether the person is having cardiovascular problem or respiratory related disease or not. So for that, TMT test or stress test is performed. TMT, treadmill test or stress test, that is also important test to evaluate whether the person is having, suppose somebody is having angina, means the person is normal in sitting or supine position, but when person performs exercise or any activity, then this anginal attack aggravates. So in that individual, what they do in this TMT is they ask the person to perform treadmill or walk on the treadmill, and along with that ECG leads are placed on the chest and ECG changes are monitored. So this way we can evaluate that cardiovascular responses to exercise. Okay, fine. Next, it is also important if the person has any cardiac problem, cardiac invalids are there, and this is important for rehabilitation. Means suppose somebody has any cardiac disease or any hypertension or any related cardiac problem, then for rehabilitation also exercise is very important. Also, it is important for screening certain workers, suppose they are having some disability or not, to find out that screening is also done with the help of certain exercise stress. One of them, that is TMT test. Okay, so this is the importance of physical exercise. Now, this exercise is of two types: dynamic exercise and static exercise. In dynamic exercise, you can say that it is isotonic muscle contraction. What do you mean by isotonic? Muscle tone remains same. Okay, tone remains same, but length changes. Okay, so this is, you can see here, length means when muscle moves, length changes. Okay, so isotonic exercise in dynamic exercise, external work is performed. Okay, whereas static exercise, here external work is not performed and length of the muscle remains same. Like when person performs stretching, that is isometric contraction or static exercise. Okay, next. Now, important thing here is grading of exercise. Grades are mild, moderate, severe, and heavy and very severe. Okay, that is depending on the heart rate. That is one parameter to grade the exercise. Okay, these parameters were given by WHO, World Health Organization, in 1978. Okay, and according to this WHO, grades of the exercise. How can we grade the exercise? Number one factor, that is heart rate, according to heart rate. Second, oxygen consumption. Okay, oxygen consumption means how much oxygen is required per minute. Suppose normally in resting condition we require 250 ml of oxygen per minute. Okay, and maximum maybe 3 to 5 liters during exercise per minute. So here this oxygen consumption, okay, accordingly also grades are given. Another is that is relative load index or percentage of maximum oxygen is utilized. How much oxygen is utilized? According to that also grades are given. And oxygen utilization, how much oxygen is utilization, accordingly we can give this MET, metabolic energy expenditure. Okay, normally how can we calculate this metabolic energy expenditure? One metabolic energy expenditure, that is equal to, you can see here in this formula we have shown that resting oxygen uptake of the individual, how much resting oxygen is required, that is 1 MET. Suppose resting oxygen uptake of adult male, that is 250 ml per minute, and female, that is 200 ml per minute. So this is 1 MET. Okay, now suppose 2 MET means double than 250 ml of oxygen is required, so that is 2 MET. Now, which are the grades? Here grades are light or mild, moderate, heavy, and very severe, according to heart rate. As I told you, normal heart rate, as we all know, 60 to 100 beats per minute. So when the heart rate is within normal range, that is light exercise. Okay, oxygen consumption, normal oxygen consumption for adult male is 250 ml per minute. Okay, here in light this is 400 to 800 ml per minute. Relative load index, relative load index means percentage of maximum oxygen utilization, means whatever oxygen is taken from which how much percentage is utilized. This is 25% is utilized from, suppose the person has taken 250 ml from which 25% is utilized. And maximum energy, this MET, that is maximum energy expenditure test, that is normal, as we have discussed, 1 MET is equal to 250 ml of oxygen is taken per minute. Here this is less than 3. 3 means 250 multiplied by 3. So less than 750 ml of oxygen is utilized per minute. So this is your grade 1. Moderate exercise, when the heart rate is 100 to 125. Okay. Oxygen consumption now again increases 0.8 to 1.6 liters per minute. Relative load index, that is percentage of maximum oxygen utilization, 50% up to 50% oxygen is utilized. And MET, that is 3.1 to 4.5. Heavy exercise, again pulse rate increases 125 to 150. Oxygen consumption 1.6 to 2.4 liter. Relative load index, that is 51 to 75. And MET, that is 4.6 to 7. And severe exercise, heart rate is more than 150. Very important thing here is heart rate, maximum heart rate, that is calculated by 220 minus age. Suppose your age is 20 years. How much or at up to which level your heart rate increases? 220 minus 20. So you can increase your heart rate up to 200 beats per minute. Okay, so this is severe exercise. Okay, so here more than 150 up to 200 depending on the age of the individual. And this is accordingly oxygen consumption more than 2.4 liters per minute, relative load index, percentage of maximum oxygen utilization more than 75, and MET more than 7. Okay, so this is about grading of exercise. Now we'll discuss adjustment, which different changes occur in our body when the person or when we perform exercise. And this changes, this adjustment, as we have discussed during exercise, what happens, our skeletal muscles, they are getting more blood flow and more energy because they are using energy expenditure. And for the skeletal muscle energy expenditure, our cardiovascular system, our respiratory system, our all other organs, cutaneous vessels, splenic vessels, all they are having that changes to maintain energy expenditure to skeletal muscle. Okay, so this adjustments they depend on different factors. Number one is grade of exercise. If we are performing severe exercise, all these changes are different. Okay, so that depends on grade of exercise, one thing. Second, it also depends on type of exercise, whether it is static or dynamic. Dynamic is your moving axis, static, that is isometric, this is isotonic. Then it also depends on cardiac reserve. If suppose some person is trying to perform severe exercise but cardiac reserve is reduced, then the changes are not possible. Also depends on muscle power. If you don't have muscle and you try to perform exercise, that is also not possible. Okay, motivation also is a factor for all this adjustment, and nutrition is also required. Okay, so now which are the responses? Here we will discuss important responses are respiratory, circulatory, and muscular, because these are the important systems. They are having changes during exercise. So as we have discussed, exercise, that is the period of increased energy expenditure mainly in our skeletal muscles. Okay, and for this energy we require fuel, and fuel consumption, that is by fuel is produced or the ATP is required to produce energy. Okay, and this fuel consumption, that is achieved by oxygen consumption. And when this oxygen is consumed, there is production of carbon dioxide. And to accommodate all these changes, we have cardiovascular responses, respiratory responses, and tissue responses. Okay, now so starting with oxygen consumption, when we are performing exercise, definitely oxygen requirement increases. So VO2, that is oxygen consumption. Okay, at rest, this value of VO2, oxygen uptake, okay, at rest, that is only 250 ml per minute. Okay, and oxygen consumption, here now oxygen consumption, suppose this is 250 ml per minute if we are talking about. So 250 ml per minute per 100 ml of blood. So suppose if we are talking about cardiac output total, so in 100 ml, at 100 ml blood flow, 250 ml, then 5000 ml, this would be 5000 multiplied by 250 divided by 100. Okay, so this is around 1250. Okay, now so oxygen consumption is partial pressure gradient of oxygen per 100 ml multiplied by cardiac output. So this is about your VO2 at rest. Now next is when we are performing exercise, when the exercise is uh, increasing the grades. So according to severity of exercise, oxygen consumption also increases. Okay, so this oxygen consumption increases to 50 to 20 times. Okay, how, why oxygen consumption increases during exercise? there are two things mainly important. One, that is arteriovenous oxygen difference increases 3 times. Now we discuss what is arteriovenous oxygen difference. Arteriovenous oxygen difference is in our arterial blood, oxygen that is 19 ml per 100 ml of arterial blood. Okay, this is normal one when we are not performing exercise. In venous blood, this is around your 14 ml 14 ml per 100 ml of blood. So how much is the difference? Difference is 5 ml per 100 ml. Okay, but when somebody is performing exercise, what happens to this difference? Arterial oxygen remains same, 19 ml, but because your skeletal muscles are taking large amount of oxygen, this becomes not 14 ml, this becomes your 4 ml per 100 ml in venous blood. Why? Because this 15 ml of oxygen is taken by tissue. So you can say that arteriovenous oxygen difference increases to 3 times. Am I clear? Instead of 5 ml, now it becomes 15 ml. So that is one thing. So our oxygen consumption, you can see here in initial stage, this is the oxygen consumption. You can see VO2. Okay. But now when anybody performs exercise, this VO2 increases, reaches to maximum value. Okay. So this is VO2 max. How much we will discuss now. So that is one factor, increase arteriovenous oxygen difference. Second thing is oxygen delivery to the tissue is also increased. Why? Because cardiac output increases, large amount of blood is pumped, stroke volume, heart rate all are increased. Alveolar ventilation is also increased. Capillary density increases, more and more capillaries are there. Spleen gets contracted, so RBCs are also released. So because of this also oxygen delivery to the tissue is also increased. Okay. Now next is maximum oxygen consumption, VO2 max. So VO2 max, that is, you can see here, initial oxygen consumption is only 250 ml per minute. You can see here this becomes more than 2.5 liters. So you can see it may reach to 3 liters per minute in adult, normal. If the person is athlete, then it may be 5 liters per minute. Okay, so this VO2 max, what is this VO2 max? It is the point, or it is the level of oxygen consumption. Okay, what is the level here? 3 liter, beyond which there is no further increase in the maximum level of oxygen consumption, you can say that. Okay, beyond that person cannot increase. Now this, how this limit can be decided? It is decided by cardiac output, because limitation is our cardiovascular system, not respiratory system. Okay, so because of now we cannot increase more cardiac output, so VO2 max depends on cardiac output, as well as it also depends on muscle mass. Okay, also depends on functional dimensions of transporting oxygen transporting system. Okay, so this now, after once it reaches, then there is steady state. Okay, you can see here. So this is EOC, oxygen consumption during throughout the exercise, and post exercise also gradually decreases. Okay, so here you can see this is VO2 max. Now VO2 max starts increasing during childhood. Okay, okay, as the efficiency increases, reaches to the peak at puberty, and then gradually decreases. It is limited, as I told you, by cardiac output, not by ventilation, not by the oxygen delivery. So these are not the factors they affect VO2. Only cardiac output is the major factor that affects VO2. And VO2, maximum O2 consumption of an individual, determines that how much is the maximum aerobic work capacity. So this is the physiological indicator of aerobic work capacity, how much maximum aerobic work capacity the individual is having. Okay, and it is highest attainable rate of aerobic metabolism. Means if this is higher VO2 max, the person can attain higher aerobic metabolism when the person is performing exercise. This is the reason you can say athletes having 5 liters per minute, so they can attain more aerobic work capacity as compared to normal individual having VO2 max of 3 liters per minute. Okay. Now, what are the criteria for establishing VO2 max? Number one, you can see here, this oxygen consumption must reach to plateau. Now it should not raise above this here. Okay. Second thing is maximum heart rate is also achieved. As I told you, maximum heart rate that is equal to 220 minus 8. Suppose if you are 20 years of old age, then your maximum heart rate is 220 minus 20. So 200 maximum. That you at that level you can say that VO2 max is achieved. Then respiratory quotient. Respiratory quotient, that is CO2 consumption CO2 production upon oxygen consumption. This is respiratory quotient. It reaches to more than 1.15. Then also you can say that that is VO2 max is achieved. And lactic acid level increases normal, that is 20 to 40 milligram per deciliter. Instead that it reaches to 70 to 80 milligrams per deciliter. So these are the criteria to establish VO2 max. Now we discuss today's topic more related with cardiovascular responses. Respiratory responses we will discuss along with respiratory system much in detail. Cardiovascular responses. Here, this cardiovascular, which responses occur when anybody performs exercise? Number one, that is skeletal muscle blood flow increases. That is first and foremost. Second, blood flow is redistributed. Redistribution means more blood flow is given to kidneys, more blood flow is given to heart, more blood flow is given to skeletal muscle, and less blood flow is given to cutaneous tissues, splenic tissues, and other tissues. They do not require that much blood flow. So in those tissues they have vasoconstriction. Third change, that is increase in the cardiac output. Cardiac output increases always. Blood pressure also changes. Blood volume also changes in different varieties of exercise. We will discuss one by one, starting with first, that is skeletal muscle blood flow. Resting skeletal muscle blood flow, you can see here in this diagram, that is only 2 to 4 ml per 100 gram of tissue. Okay, 100 gram of tissue per minute. This is normal value, may be asked as a MCQ. So if we are talking about skeletal muscle tissue, if it is, this is for 100 gram. Okay, or if we are just talking about the value, that is around 750 to 800 ml per minute, total skeletal muscle is having this much blood flow. Okay, during exercise this increases 20 times. So you can say that from instead of 2 to 4 ml, now it reaches to 50 to 80 ml, and maximum here it may reach to, instead of 1 liter, this becomes 20 liters. So that is one of the very important change during exercise, that skeletal muscle blood flow increases. And this is known as exercise hyperemia. Hyper means increase blood flow. Now, what are the causes of hyperemia? Why during exercise skeletal blood flow increases? Number one, first factor, that is arterioles are dilated, and this dilatation is because of sympathetic stimulation normally causes vasoconstriction, but only skeletal muscles as well as sweat glands and some other tissues, they have acetylcholine as neurotransmitter. So when acetylcholine is released, there is dilatation of the blood vessel. So that is one of the important local factor. Second important factor is capillary density increases. More and more capillaries they get open up. So surface area increases. More the surface area, more will be the blood flow. Okay. Next, which are the factors they are responsible for increased blood flow during exercise? First of all, as we have discussed, local metabolic factors like lactic acid production, you can say that carbon dioxide production and other metabolic waste products, they increase skeletal muscle blood flow by causing local vasodilatation. Okay. Second mechanism we have discussed, that is sympathetic nerves. Sympathetic vasodilator fibers are there to the skeletal muscle. Okay. So here flow induced vasodilatation. Okay. Dilator formation in the circulating muscle. Another important thing here is humeral mechanism. Certain uh, neurotransmitters, commonly your sympathetic neurotransmitter, norepinephrine, epinephrine, they cause vasodilatation. Okay. Another important thing is blood flow through non-exercising muscle also increases because of sympathetic activation. So this is also one of the Advantageous effect of exercise, that non-exercising muscle are also getting blood flow. Okay, sometimes very important interesting thing here is muscle blood flow increases before we start exercise. This is known as anticipatory rise in heart rate and blood flow. Okay, and continues to increase till the steady level is reached. Why is it so? Because of the impulses they are coming from the hypothalamus. We have increased blood flow. Okay, sometimes before 1 to 2 minutes of exercise there is increase in the blood flow. Okay, now, next is, as we have discussed, arteriovenous oxygen difference increases 3 times. We have discussed normal arteriovenous oxygen difference, that is 19 ml arterial, 19 ml per 100 ml of blood arterial oxygen content, and venous, that is 14. This becomes 5. Instead, now it becomes, you can see here, 19 arterial remains same. Okay, but venous becomes only 4 ml per 100 ml of blood. So this becomes arteriovenous difference becomes 15 ml per 100 ml. So you can say that it is 3 times. Okay, another is this. What is the cause of this? That is shift of oxygen hemoglobin dissociation curve. As we all know that oxygen hemoglobin dissociation curve, when shifts to right, that causes release of oxygen. Okay, and what are the reasons for shift to right? Temperature increases in the exercising muscle, partial pressure of carbon dioxide increases, arterial partial pressure decreases, that is hypoxia, and decrease in the arterial pH, or increase in the H plus ion concentration. So this cause shift to right, and more amount of oxygen is released to the tissue. Okay, now next is redistribution of blood flow. Redistribution means now some of the organs are getting more blood flow and some of the organs are getting less blood flow. What is it? First is coronary blood flow. Coronaries are the nutrient vessels, they supply myocardium. Okay, so this coronary blood flow at rest, that is only, remember this value also, very important one, may be asked as MCQ. Coronary blood flow is 250 ml per minute, or you can say this value also, you can remember 70 ml per 100 gram per minute. Okay, and here this coefficient of oxygen utilization means whatever oxygen is given, from which 70 to 80% of oxygen is utilized. Normally this is in the resting situation. Now during exercise, what happens? Coronary blood flow increases. This increases 4 to 5 times. Okay, that is one thing. Second thing is coefficient of utilization, instead of 70 to 80% it becomes 100%. Okay, and what are the causes of increase in the coronary blood flow? Number one is heart activity increases, cardiac output increases, and mean arterial pressure increases, as well as coronary vessels are dilated. Why are they dilated? Because of release of catecholamines, decrease oxygen, that is hypoxia, blood pH decreases or increase in the H plus ion concentration, and this ATP and ADP, they also are responsible for increase in the coronary blood flow. Okay, now next is visceral blood flow. Some visceras, their blood flow is temporarily reduced. Okay, and this reduction is coordinated with increase in the muscle blood flow. So total blood flow is same, but there is, you can say, redistribution of blood flow. Okay, redistribution of blood flow means skeletal muscles are getting more blood and other tissues are getting less blood. Okay, so this is your redistribution of blood flow. Okay, what is the cause for this redistribution? That is because of increased sympathoadrenergic discharge. Sympathetic adrenergic discharge increases. Okay, so here now here renal blood flow, if we are talking, renal blood flow decreases 50 to 80%, as well as splanchnic blood flow to the spleen, that decreases 80%. Okay, now cutaneous blood flow to the skin, at rest blood flow to the skin is only 500 ml per minute. Okay, and blood flow changes during exercise, that depends on severity of exercise. Here in the beginning of exercise, cutaneous blood flow decreases because of vasoconstriction. Okay, but if exercise continues, then blood flow increases. Why? Because vasodilatation, that causes increase in the heat loss, and for vasodilatation impulses are coming from hypothalamus, that causes heat loss. What is the advantage? more amount of heat is lost, and that along with that metabolites are transported. Okay, during severe exercise, again vasoconstriction is there, that is for redistribution, and again blood flow decreases. Next is adipose tissue blood flow. During exercise, this adipose tissues, you can see here, this white adipose tissue, mitochondrial activity, glucose uptake, adipokine secretion, all are increased here. So during exercise, this adipose tissue blood flow increases 4 times. And what is the advantage of this increased blood flow? From adipose tissue, fatty acids are delivered, mobilized, and from fatty acids are mobilized, as well as this storage form of fatty acids are mobilized, and energy is produced, which is used by the muscle. Okay, so this is the advantage. Very important, that is now cerebral blood flow. At rest, cerebral blood flow is about 750 ml per minute. There are no major changes in the cerebral blood flow, because cerebral blood flow is regulated, auto regulation is there, okay, between blood pressure 60 to 180 millimeter of mercury. So till the blood pressure falls or rises above this, there is no much change in the cerebral blood flow, because brain requires oxygen and blood. So there is no much change in the cerebral blood flow. You can see here, this is the redistribution. You can see here, this is in resting condition, all the systems are getting blood flow. Okay, digestive system, here you can see, then heart, coronaries, kidneys, bone, cerebral. You can see here, this will not change, these are same, remaining same. Skeletal blood flow increases, okay, cutaneous blood flow decreases. So this, you can see, these are the blood flow to the different organs during resting condition and during heavy exercise. You can see here. Yeah. You can see here, digestive blood flow in resting condition is 20 to 25. Now it reduces to 3 to 5% during heavy exercise. Okay, as well as instead you can see here 15 to 20% skeletal muscle blood flow, now it becomes 80 to 85%. So this way you can say that redistribution takes place, otherwise cardiac output is not changing, or blood flow is not changing, total blood flow is not changing, but that is redistributed. Okay, now next is pulmonary blood flow. As you all know, in lungs there are 3 zones: zone 1, 2 and 3. In zone 2, there is, this is zone 2, blood flow increases, okay, during systole and decreases during diastole. Okay, this is zone 2. And zone 3, that is, blood flow is continuously during systole and diastole, blood is flowing. Okay, so normally what happens in apex, we don't have zone 2, little zone 2, but, or you can say zone 1 here. Zone 1 means there is no blood flow during systole. Okay, systole, no blood flow during diastole. Okay, and zone 2 and zone 3 blood flow. But when we are performing exercise, the zone 2 blood flow is there in the apical part also. We will discuss in detail with the respiratory system. Okay, but here at present you can see, you can remember this, at rest pulmonary blood flow is only 350 to 800 ml per minute, and this increases linearly with increase in the cardiac output, and it is highest up to 1400 ml per minute during severe exercise. Okay, now cardiovascular changes, heart rate also increases linearly with the severity of exercise. As we have discussed, before we start exercise also there is tachycardia. This is known as anticipatory tachycardia. Why anticipatory tachycardia? That is because of the sympathetic activation. Okay, our hypothalamus starts generating impulses. Maximum heart rate, as I told you, how much is the maximum heart rate? 220 minus age. This is the maximum heart rate. Heart rate decreases with increase in the age. That is one thing. Second, if a person is having training sessions, then also heart rate decreases. As we all know, athletic bradycardia, athletes having bradycardia. Why athletes having bradycardia? Because of increase in the vagal tone. That is one thing. Second thing, second cause for athletic bradycardia is they have decreased sensitivity of the sympathetic neurotransmitters, because of the psychic stimuli also decreases. So because of physical training also, much rise in heart rate is reduced. Okay, now which are the factors they produce tachycardia during exercise? Even athletes also, they have increased heart rate, not tachycardia, may not be having more than 100, but increased heart rate. What are the causes for increase in the heart rate during exercise? Number one is sympathetic nerves, they are discharging. Second is neural factor, peripheral reflexes are there. Which are the peripheral reflexes? Suppose muscles, tendons, joints, when they are moving, okay, impulses are transmitted through this muscle spindle, Golgi tendon organs, and other joint receptors to the brain, and they increase the heart rate and increase the blood pressure also. Okay, certain central reflexes are also there due to increased activity of the limbic system and motor cortex. When this activity of limbic system and motor cortex increases, this is because of the psychic stimuli that directly acts on the medulla and that directly affects the heart rate, and here vagal tone is reduced. Okay, as well as another third mechanism. So this is sympathetic mechanism, second is neurogenic control mechanism, and third is local metabolites. As I told you, lactic acid is produced in the exercising muscle, potassium ions, other metabolize in the exercising muscle, they also stimulate the free nerve endings, and these factors also increase the heart rate when the person performs prolonged exercise. Okay, humoral factors are also important, like as we have discussed, adrenaline and noradrenaline. These are sympathetic neurotransmitters also, as well as they pass through humors, body fluid also, and they also increase the heart rate. Intrinsic factor, Bain bridge reflex. What is Bain bridge reflex? When venous return to the heart increases here from the veins, there is stimulation of SA node, and when SA node gets stimulated because of stretching of the right atrium, there is increase in the impulse discharge. This is your Bain bridge reflex. That is also responsible for increase in the heart rate. Okay, heart activity also increases during exercise because temperature increases. Okay, and as the temperature increases, pacemaker activity increases. Okay, as well as certain chemicals, chemoreceptors are also stimulated. Chemoreceptors are stimulated by change in the PO2, PCO2, and PCO2 and H plus ion concentration. They also increase heart rate. So these are all the factors they affect heart rate during exercise. Next is stroke volume. Here you can see resting stroke volume is, as we all know, 70 to 80 ml per minute. Okay, and this becomes double. You can see here stroke volume, instead of 70 to 80 ml here, this becomes double, approximately double during exercise. Now, what is the mechanism? As we all know that more amount of blood is coming back through the veins, more the stretching and more will be the force of contraction. So venous return increases because of muscle pump, because of respiratory pump, because of modification of the tone of capacitance vessel. Because of all this, your stroke volume also increases. Okay, second factor is, this is intrinsic mechanism. Second is extrinsic mechanism. Extrinsic, that is because of autonomic and neural mechanism. Autonomic nerves, sympathetic and parasympathetic, they also affect myocardial contractility. Epinephrine and norepinephrine, they increase myocardial contractility and they increase stroke volume also. Okay, now here in mild to moderate exercise, venous return increases, so pumping and stroke activity and stroke volume increases. And in severe exercise, because increase in the end diastolic volume, that increases stroke volume, as well as sympathetic discharge also increases stroke volume. But here important thing is, you can see here, after certain level, the stroke volume becomes steady. You can see here little or no further change in the stroke volume when your heart rate reaches to 120. This is very important thing. Why? Because when heart rate increases, duration of diastole decreases, and as the duration of diastole decreases, diastolic filling is reduced, and when diastolic filling is reduced, end diastolic volume is reduced. So you can say that here, when heart rate reaches to 120, now no further increase in the stroke volume, and this is very important for athletes, because athletes, they are not increasing their heart rate, and as the heart rate is not increased, what happens? Stroke volume can be increased. You can see here, till the heart rate is not reaching to the 120, the stroke volume. So for athletes, the curve is like this. You can see stroke volume increases continuously before rising the heart rate here, this way. So it can rise more than normal individual. Okay, fine. So the stroke volume can be raised in athletes because their heart rate is controlled. Next is cardiac output. Normal cardiac output, we all know that 5 to 6 liters, and here cardiac output increases because of both heart rate and stroke volume increases. So during exercise, heart rate and stroke volume increases, that increases your cardiac output. Okay, and this depends on the severity of exercise. In severe exercise, cardiac output increases 5 to 6 times, and young individuals, they have higher maximum heart rate. Okay, maximum heart rate is higher in young individual as compared to the aged individual. Okay, so higher maximum heart rate, so higher value of cardiac output is also achieved in the young individual. Okay, then comes blood pressure. In systemic circulation, first we discuss systolic blood pressure. You can see here it rises linearly with the severity of exercise because of increase in the cardiac output, and linearly that systolic blood pressure increases. This increases reaches highest up to 200 millimeter of mercury. It cannot increase more than this. Okay, increase is more in sometimes in adult or older individuals. Why? Because in older individuals, the systolic blood pressure is increased because of the resting systolic hypertension due to atherosclerosis. Okay, and blood pressure increases because of increase in the cardiac output and vasoconstriction, not only in exercising muscle but also in non-exercising muscle. There is increase in the cardiac output because of increase in the blood pressure because of increase in the cardiac output and vasoconstriction. Okay, diastolic blood pressure, you can see here, that will not much change. Diastolic pressure doesn't change much during mild to moderate exercise, but during severe exercise it also rises because of severe vasoconstriction in non-working muscles too. Okay, then mean blood pressure also increases. Mean blood pressure is equal to diastolic pressure plus one third of pulse pressure, and that is equal to 90, around 90 millimeter of mercury. Okay, and mean blood pressure increases during exercise. You can see here from 90 to 140 millimeter of mercury. Here in this diagram you can see 90 to 140 millimeter of mercury mean blood pressure rises. Okay, what is the advantage of increase in the mean blood pressure? That is, mean blood pressure, it denotes that greater pressure, it provides greater pressure head, and that helps to increase skeletal muscle blood flow. So pressure head is provided, and as the pressure head is provided, skeletal muscle blood flow increases. Okay, so this is the advantage of increasing the mean pressure. Then pulmonary pressure. Pulmonary pressure, systolic and diastolic, both are increased. Systolic pressure, which was normally, you can see here, between 15 to 20 millimeter of mercury, now it rises to 25 to 30 millimeter of mercury, here this much. Diastolic pressure rises from 5 to 8 millimeter normal millimeter of mercury to 8 to 10 millimeter of mercury. And mean pressure, that is rising from 8 to 12 millimeter of mercury to 15 millimeter of mercury. Okay, so these are the changes in pulmonary circulation. Okay, so this is all about today's topic. If you like my video, you can like it, you can share it with all your friends, and you can subscribe our channel Unacademy Future Doctors. Thank you.